Hello, I'm Mabel John reporting for the World Healthcare Congress 2021. Thanks for joining us. With infertility affecting 1 in 8 individuals in the US, what is the role of employers in such a personal situation? Joining me now is Dr. David Adamson, a globally recognized reproductive endocrinologist and surgeon. He's also a clinical professor at Stanford University School of Medicine and the founder and CEO of ARC Fertility. Dr. Adamson, thanks so much for your time. It's great to see you.
Thanks for having me today, Mabel. Nice to talk with you.
Well, like other medical conditions, infertility drains employees. Is it inevitable that companies play a more proactive role by offering fertility benefits?
I think that's a great question, Mabel. And yes, I think the answer is that it's really important for employers to get involved and actually for some very big picture reasons, not to mention the more prescribed ones around infertility benefits and fertility benefits. I think the first thing is that we can all see our country is facing a lot of very challenging issues these days, and solutions to these problems are really going to take the involvement of everyone. It's going to take the involvement of the government and the public, but also our employers that have a very important role in helping to address these issues of diversity, equity, and inclusion, which we know are really coming across the country like a tidal wave and in which everyone is interested. And we also, of course, know that there are a lot of economic factors that are affecting the country now, and employers, of course, are intimately involved in dealing with the economics of the country. And fertility benefits are a very significant economic issue for people who have infertility. There's also, the fact that in employment today, we're looking at a real generational change in the type of people who are younger now, of course, and coming into the workforce. And they're really looking for a very different workplace environment. And especially with COVID having happened in the last year, we've seen that so many people are not only working at home and changing their work life, but they have very different needs in terms of childcare and adult care, and in terms of how they're going to manage their personal lives in a very, very different way than what it was even a year or so ago. And of course, employers have a critical role to play in how their employees live their lives, because if their personal lives are good, then clearly their work life is going to be much more productive and good for the employer. And so there are really multiple ways in which I believe employers are directly involved in the general health and the emotional health and the goals and purposes of their employees. And we know that with the great challenge now to find really good talent, that it's important for employers to be able to meet the needs of their employees when they look at this. So I think there are multiple reasons that employers need to be involved. And of course, on top of all of that, here in the United States, the healthcare system benefits are largely delivered through employers. So they have to be involved because that's the structure of our healthcare system right now.
Can you offer some perspective as to what employers should be prepared for if they go down this road by offering these benefits to employees?
Well, I think what they should be prepared for is to know that many employees have needs that they don't express overtly to their employers. With certain types of needs, for example, extra time off, or someone wants a raise, most people are pretty comfortable talking about that, with their employer. But something like infertility and fertility care is not something that many people are interested in talking about. And so there's often a perception that, well, nobody's really interested in this. We shouldn't, why should we bother with this? In actual fact, as you mentioned at the beginning, about 1 in 8 people suffer infertility throughout their reproductive life. Now, in actual fact, that translates into approximately 1% of employees needing to use a fertility benefit in any given year, about 1%. So it's not 1 in 8 every year, it's 1 in 8 over the reproductive lifespan, and it's about 1% a year. So the first thing is that it's a lot of people who are affected. And secondly, it's a relatively small proportion who will actually need the benefit at any one time. So this is a benefit that will help over time a lot of people in the company, but it won't be a huge expense or cost at any one time if the benefit is brought in. And I think most employers are not really aware of that. It's also true that, of course, fertility care these days now is being used by many, many people in diverse communities, which were not addressed before. And so since diversity, equity, and inclusion is so important, and including in particular in reproduction, the LGBTQ plus community, it's very important to address their needs because many of them do need the reproductive technologies in order to meet their family building goals. And so a larger percentage of them, of course, in that group are going to want to use these benefits. And so overall, it's still going to be about 1%, but it will be very, very helpful and very important. And the people who do use it, the employees do use it, will be very, very grateful for having these benefits.
Well, the World Health Organization has designated infertility as a disease, but most employer benefit plans now do not cover its treatment. What would a infertility informed policy look like?
Well, that's a terrific comment about disease because indeed, it was only the World Health Organization in 2009 that recognized infertility as a disease. And it was not until 2017 that the American Medical Association actually determined that infertility was actually a disease. And of course, this matters because it puts more recognition to it and it gives a better opportunity for coding it, tracking it, and managing it within a company. And so I think the fact that it's now recognized as a disease means that it's much easier for employers to look at how they can bring this benefit on board. And so that actually has been a very important change. And just while we address that aspect of it, Mabel, I'd like to point out that only last September, the World Health Organization put out an infertility fact sheet. And in that fact sheet, they recognized that fertility care was not something needed just by heterosexual couples, but by many people in order to, reach their family building goals. So I think there's been a real trend, both in the United States and even globally, in the last 5 to 10 years to recognize infertility as the important disease that it is, and that it can affect everyone. And that's why it's so important to address it from a comprehensive, diversity, equity, inclusive approach to the benefit, and to recognize how significant this is and how it can help so many people.
Now, tell me a little bit about ARC Fertility. What are some of the positive impacts that the company you started has had on the industry overall?
Well, I started this company back in 1997, Mabel, and the reason I started it was really very simple. I wanted to increase access to quality care. And so that meant that we had to have doctors that could provide really quality medicine. Of course, there are a lot of very good doctors out there, but I think it's really important to get doctors that want to follow evidence-based, cost-effective medicine. And so we put together a network of doctors. We have our physicians all over the country now, providing about 25% of all the cycles in the country. So we really have developed the centers of excellence. We carefully vet all our physicians because of positions and things that I've done around the country. I know most of these doctors, if not personally, certainly as an acquaintance. And so we're very careful in putting together a centers of excellence that I really think help to set a standard in what type of quality care should be. And the standards we use are the American Society of Reproductive Medicine, not only practice standards, but also ethics standards in terms of how you should practice medicine. So I'm very proud of the fact that I think we brought a sense of quality and importance of that to the country. Over that time, we also really helped make fertility benefits affordable in the direct-to-consumer market, where we've been for 23 years. And how we did that is that we worked with multiple lenders to come up with a program that really enabled many people who did not have cash on hand, because of course, many of the people needing these services are younger. They're in their late 20s, early 30s, mid 30s. They still have school debt. They're trying to buy a house. They are trying to get going with their families, and so they don't have a lot of spendable cash. And so to make it affordable, we came up with affordable plans. And then we also designed the plans that would be very cost effective by using evidence-based medicine, not having unnecessary services, adding extra frozen embryo transfer in each package, and having multi-cycle packages. We really brought a lot of innovative changes to the marketplace in terms of how we could provide everything that's needed, but not more than is necessary. Just, the appropriate evidence-based care. And so I believe by bringing a comprehensive package of affordability, it's made a big difference. And we've served over 4.5 million people and helped tens and tens of thousands of people have babies. So I do believe we've had a real impact. And now we're delighted to be able to move our program, which has, of course, been designed and modified for the employer space. But the reason we're so excited about that is we know, as we discussed earlier, that the employers play such a critical role in healthcare in the country and how we're going to, bring these benefits to people. So that's what we're working on doing.
Well, it sounds like your phone was ringing. You're a
Yeah.
popular guy, Dr. Adamson. No worries about that. In your marketing materials, it's pointed out that you have a background in reproductive endocrinology. Do a lot of these practices not have the same kinds of experience, perhaps?
No, they don't. And I think the real issue is that infertility is actually a very complex area of medicine that includes, couples. So often when a patient goes to a physician, there's one patient. But in reproductive medicine, there's two at least most of the time. And you need to have sperm, and you need to have egg. You need to have someone who's going to carry the baby. Sometimes you have different intended parents, and so the whole process can be very, very complicated. The clinical care is complicated because there's medical care, there's laboratory care, there's surgical care that's involved. There are a lot of financial issues, as we've discussed. There's a lot of very significant emotional issues that need to be supported. So infertility is a complex area, and I feel I've been very, very fortunate, of course, by working as a physician, seeing patients for over 3 decades. I really do understand what's needed in terms of providing the care for patients. I was very involved in the consumer organizations, as well as on the National Resolve Board for 10 years. And so I really gained an appreciation of the emotional challenges and the financial hurdles that patients had to overcome. And that really affected, how I practiced and how we wanted to put our company programs together. And then I ran a business. My clinic was a small business, and we had to deal with, the cost of benefits and everything else as well. So I got experience with that. In addition, I was very involved in professional organizations. So I learned a lot about how they work in the country and about developing standards and guidelines. And in my research, a lot of my research has been around cost effectiveness and affordability. And so I feel fortunate that I've had a career that's enabled me to look at all the different aspects of putting together a program that's going to be comprehensive and it's going to have quality and it's going to be affordable. Because if it's not just making it affordable for the employee, it has to be affordable for the employer, and I appreciate that. And so our programs put together to make it affordable for the employer.
Well, speaking of research, it's clear that experiencing infertility can have a tremendous impact on the daily life and professional roles of women and men. Do you think that companies, if they do step into this arena by offering these kinds of benefits, it will help mitigate some of that stress that people have when they're trying to grow their families? And maybe overall, that will have an impact on infertility rates.
That's really important question, and the answer is yes, it will have an impact. Just in general, there's certainly studies out there that by providing benefits that support employees, the revenues per employee go up and profits go up. With employees, we did a study with National Resolve, and it showed that when employees had fertility benefits at work, they were far less likely to miss work. They were more likely to be present at work and to be productive at work. They were far more likely to think well of their employer as a good place to work. They had very positive feelings about the employer. And importantly, they were 1.5 times more likely to recommend their employer as a place to work. So it showed that not only did it enable them to get the care they wanted to meet their family building and life goals, but it also gave them very positive feelings and an improved relationship about their employer. And this turned into real, productivity and dollars for the employer, and obviously a much better culture at work. And this of course is going to be at least as significant with the LGBTQ plus and communities, the diverse communities, because in the past they've had no support for much of this. So the support they get, I'm sure, will be very much appreciated and reciprocated in improved productivity for the employer.
All right, Dr. Adamson, it's been such a pleasure speaking with you. Thank you so much.
Oh, thank you very much. It's been a pleasure speaking with you, Mabel.
I'm Mabel John. You've been watching the World Healthcare Congress 2021 interview sessions. Thank you.
Thank you very much.